Bismillahirrahmanirrahim. Assalamu alaikum friends. Welcome back. This is Dr. Abid Sargani. Friends, today we will discuss about the poultry pathology. In, in our previous topics, we have discussed a few topics about the poultry pathology. In today's lecture, we are going to discuss about the Hydropericardium Syndrome in poultry. So let's discuss that. What is the importance of the Hydropericardium Syndrome and how this disease can be prevented or diagnosed in poultry flocks. I'm going to tell you about the details of the Hydropericardium Syndrome and its prevention. So first of all, in our introduction, Hydropericardium Syndrome can also be called as the Angara Disease, Hydropericardium Hepatitis Syndrome, Leachy Disease, Hydropericardium Pulmonary Edema cum Hepatonephrosis Complex. These were some of the synonyms of the Hydropericardium Syndrome, which will be later discussed that on which basis these have been given names. So if we talk about the history of the Hydropericardium Syndrome, Hydropericardium Syndrome first time in Pakistan were reported in 1987 from the village Angara Got in Karachi. That's why this disease also named as the Angara Disease. Later in 1988 it was found in Faisalabad, Pakistan, and now this disease has been spread to all over the Pakistan. Other countries which are also affected by this disease of the Hydropericardium Syndrome includes India, Jordan, Iraq, Kuwait, and Latin America, etc. If we talk about the etiologic agent or the causative agent of the disease, avian adenovirus belonging to the Adenoviridae family, serotype 4, is the major cause of the Hydropericardium Syndrome. Next, if we talk about the characteristic of the adenovirus, it belongs to the DNA virus families, and it also non-enveloped virus. And serotypes include K31, 89, a New Pakistan isolate is also reported currently, and wrong cell type, cytopathic effects on the chicken embryo, liver cells, 12 to 16 hours after the experimental inoculation into the embryo of the liver cells of the embryo. Now, if we talk about the epizootology of the disease, first of all, we should know about what is epizootology. It is the science which concerned with the factors involved in the occurrence and spread of the animal diseases. Now, the susceptible host of the Hydropericardium Syndrome includes the broiler and broiler breeder flocks, heavy strains of the white leghorn, and sometimes affected also in layers, and colored heavy breeds of the chicken are also sometimes susceptible. But this disease mostly affects the broiler and broiler breeder flocks. Now the epidemiology of the transmission of the disease, how it occurs between the flocks has not been reported yet, but within the flock it occurs through the feces to oral route, and vertical transmission can also be occur, and experimental transmission proved using the affected liver homogenate. Now the factors influencing the susceptibility of the birds: age specificity, highly pathogenic for the day-old chicks, causing more than 80% mortality, and most susceptible age of the outbreak is 3 to 6 weeks and may be 15 days to the 10 weeks of the age. No sex predisposition, it means there's no predominance or the predilection to the male or female, both can be affected equally. Overcrowding may be the cause risk factor, hepatotoxins are the mycotoxins, and research is also going on these topics, and stress may be responsible or may not be, and high infection pressure. Now if we talk about the pathogenesis of the disease, so first of all, ingestion of the organism from the feces occurs, which results in the viremia, which causes the location of the organism or the pathogenic organism toward various organs like liver causing the hepatitis, and in heart is causes the pericarditis, and in kidney damages via the billet, and damage to the billet vessels of the pericardium and thrombosis. After that, hydropericardium and pulmonary edema due to fluid exudation. That's why it's also named as the hydropericardium edema cum pulmonary disease, and sudden death occurs due to the lungs and heart failure. Now, clinical signs of the disease: chalk gray white to greenish yellow mucoid droppings is the clinical sign of the hydropericardium syndrome. Morbidity is not much, but mortality is high. Jaundice in some birds, there's yellowish comb and wattles, and sudden onset of the mortality, which starts in third or fourth week and peaks in the 4 to 5 days and subsides during the next 4 to 5 days. Mortality rate varies between 5 to 50%. Now, if we discuss about the course of the disease, it is 10 to 15 days. Post-mortem lesions of the disease: congestate or the febrile carcass sometimes. And if we note about the pericardial sac itself, it is membranous and transparent. Pericardial fluid accumulation occurs, which ranges from the 5 to 18 ml increased, and color of the fluid may vary from the clear light yellow straw color to cerosanguous, and not clotted fluid becomes gelatinous upon exposure to air, and its protein content is reaches to 1 to 1.8 gram per deciliter. Now the postmortem lesions: further, heart becomes misshaped than their regular shape, and congested liver, enlarged and fragile earlier, and in later stages of the disease, pale ectric with massive necrosis occurs in the liver, that's why called hepatitis, and pulmonary edema in about the 50% of the cases. Lungs become sunken or shrinking. And it's also said that hydropericardium syndrome may also call the incluent body hepatitis. Kidneys mostly pale, may or may not be swollen, sometimes hemorrhages, and urates in the ureters may be found on the examination of the urinary tract, and subcutaneous and other body fat becomes yellow. Mucoid enteritis means inflammation of the intestine, and bursa may be atrophied or reduced in size. Spleen sometimes involved may be swollen or the atrophied, and pale bone marrow, especially in ectric birds. Bone marrow may also become pale. Now, this comes to the point that how to diagnose the disease or differentiate from other diseases. Now, disease diagnosis can be done by various means. First of all, gross and histopathological changes in the liver may be noticed first, and later on serological tests may diagnose the virus, such as agar gel immunodiffusion, counter immunoelectrophoresis, indirect hemagglutination, the fluorescent antibody technique, enzyme linked immunosorbent assay or ELISA, and the PCR or polymerase chain reaction may helpful for the diagnosis of this pathogenic organism. Now, if we watch about the necrosis, that you may found this fluid increased from the normal 3 to 5 ml to 18 ml in size, and the heart becomes enlarged due to the pericardial sac fluid accumulation. Accumulation of clear straw colored fluid in the pericardial sac, and heart looks like peeled lychee fruit. That's why it's named as lychee disease. Discolored and swollen friable liver may be found in the necrosity bird. Now the prevention. How can we prevent it? the live and attenuated vaccines are available, but they did not give the satisfactory results. So that's why they are not be chosen as the choice of prevention of the hydropericardium syndrome. So the hygienic handling and the biosecurity measures are suggestive control measures of the disease only. There's no fully control on the this virus yet. Thank you very much for watching my videos. Subscribe and like my videos for further notifications. Thank you very much.